Assalamu alaikum wa rahmatullahi wa barakatuhu, esteemed viewer at MTA for Africa. This is your program once again, Healthy Check, a program where we share health advice for the benefit of you, our viewer. And today's program, we're going to discuss about candidiasis. What is candidiasis? The facts that I found out about this disease is that it's a disorder that can be caused by a number of things such as pregnancy and uncontrolled diabetes. Infections of the mouth can occur in about 6% of babies less than a month old. About 20 of those receiving chemotherapy for cancer, and 20% of those with AIDS also develop the disease. Much more is going to be discussed about this bacteria, and with me is Dr. Becca Kalinachi to help us go through the program and understand what candidiasis really is. You're most welcome, Doctor. Later on in the program, it has been our norm that we invite some experts outside the studio, and today we have our medical expert, and that is Dr. Ivan Muchunguzi, will be helping us also understand more about this disease. Dr. Beck, I turn now to you. I need you to widen the explanation for our layman outside there to understand what candidiasis really is.
Yeah, thank you, moderator, thank you.
Candidiasis, like you were explaining, it usually comes in those conditions which you talked about. You mentioned pregnancy, you mentioned HIV, AIDS, and controlled diabetes. But to make it more clear, it is a fungal infection caused by any type of candida. The commonest is called the Candida albicans. What I have to note here is that the causative organism of Candida lives within our bodies. So once those conditions talked about, pregnancy, uncontrolled diabetes, HIV, once those conditions are with a person, their immunity is lowered, and this yeast can cause the infection. In other words, it is caused by our normal flora. Yeast is part of our lives. So as long as there is no balance between the body's immunity and the yeast in the body, that fungus, that yeast will cause the candida. So it is caused by reduced immunity, mostly seen in those conditions talked about, the pregnancy and the controlled diabetes, HIV, AIDS, and so on.
Okay. Doctor, how can one know that she has candidiasis?
Thank you once again. Now, candidiasis depicts itself according to a part which is affected.
Okay.
If I measure on the vaginal candidiasis, this is the candida which affects women's private parts. So a person will know, one, by having itching. They'll be feeling too much itching, and anytime they feel like scratching. Then two,
just like we see on the screen, our beloved viewer, that's what doctor is trying to explain. Okay, doctor, go ahead.
Exactly, thank you. As you can see on the screen, you can have the vaginal itching. Also, you can have painful urinating. A person goes to make short call and she feels pain. You can also have painful sexual intercourse because we say the infection, the candida, affects that part, so it will be hard and painful and uncomfortable when having sex, the woman. Also, in advanced stages, a woman can see abnormal discharge. When they see that discharge which is not normal, then it may be caused by the candidiasis.
Okay.
Yeah.
Okay, thanks a lot, our beloved viewer. Like I promised you earlier that we shall be joined in by our brother, a medical expert, that is Dr. Ivan Muchunguzi, who is online and has been following. Dr. Ivan, the question for you is that can candidiasis reveal itself in more than one way? Dr. Ivan.
Okay, thank you so much, data of today. I'm by names of Dr. Muchunguzi Ivan, a medical doctor working with Mulago Hospital here in Uganda. Now about Candida. Candida is a yeast, a fungus infection, which is caused by a fungus called Candida albicans. And the commonest infection related to Candida albicans is vaginal candidiasis. And among the ways through which this vaginal candidiasis is spread, like I was just with some people, it is generally spread through failure of the immune system. Many people know this one as sexually transmitted infections, but those people don't have much knowledge about that. And I'm here saying that candidiasis, the one which is also called candidiasis, is not sexually transmitted, but it is caused when there is an imbalance between the yeast in the body and the normal flora in the body. Normally, we have some bacteria in the body which help us to fight against infections, but sometimes when they are suppressed and they go down, then these yeast grow up and then someone gets candida. Majorly, that's how it is spread, but sometimes it can be direct and sometimes it can be indirect, especially when you come into contact with someone who has candidiasis. But this one is common into other forms of candidiasis like oral thrush, which appears in the mouth. So generally that is it about how it is spread and the commonest form of candidiasis. Thank you so much.
Okay, thank you so much, Dr. Ivan. That has been Dr. Ivan there for you, just like you've had him, Doctor.
Yes.
Now I take you to any types of candidiasis, if there is.
Yes, sir. Thank you once again. Yeah, candidiasis shows itself in different forms, in different types. It's basically basing on the part where it is affecting. For example, if it's Candida of the woman's private parts, we call it vaginal candidiasis. The other candidas, say like Candida of the mouth cavity,
Okay.
the mouth, the gullet, which is the throat, is called oral candidiasis. It can, in that case, be. Then you can have esophageal candidiasis, Candida of the esophagus. That's where the food passes when you eat your food. So if the infection is in those parts, it's also called Candida. So you can have vaginal candidiasis, the commonest, vaginal candidiasis and oral candidiasis.
Okay.
Yes.
Thanks a lot, Dr. Baker. This now takes me to my brother, that is Dr. Ivan Muchunguzi, who I would like to take us through what the causes of candidiasis are. Dr. Ivan, I turn to you now.
Thank you so much once again, moderator of today. Normally, the causes of vaginal candidiasis are generally about our behavior and the type of foods which we eat. Like I told you before, many people think that this vaginal candidiasis is a sexually transmitted infection, but it is not, as many people stipulate it. It is just an infection of lowering of the immune system of the body. This can be when you overtake antibiotics, especially when they are not necessary, and then they suppress the normal flora, the normal bacteria which help us in fighting infections, and then these yeast to grow and end up into an infection. Then secondly, when you're stressed. Like we all know, stress lowers the immune system. So whenever we are stressed, the immune system goes low, and the body is giving a chance to this yeast or fungal fungus to grow and cause candidiasis. Then thirdly, the type of food we eat. Like I told you before, this infection is caused by yeast or fungus. So when you take food which is more rich in carbohydrate foods and having more of sugar, you're giving a chance to the yeast to grow, and thus it will end up into a candidiasis. Then the other cause of candidiasis is when we are not having a proper hygiene, especially as when it comes to ladies, you find you're putting on too much tight clothes and inputs, and you're giving chance to the fungus and the yeast to grow. In such a case, you also be at a risk of getting and contracting vaginal candidiasis, which I've talked about as the commonest cause, the commonest candidal infection which exists. Most of those are the causes, and at this time, allow me to thank my entire team of today, which has given me this opportunity, and also thank the viewers for giving their time to attend to me. Thank you so much. We hope to continue responding to the concerns of the people and the viewers.
Thanks a lot, Dr. Ivan, for such a wonderful enlightenment in as far as candidiasis is concerned. Dr. Baker,
Yes, sir.
prevention is better than cure,
Absolutely,
right?
absolutely.
So how can one prevent themselves from getting this disorder?
Thank you once again. As usual, our motto is prevention
Is better than cure.
Prevention
is
is
cheaper.
Cure is expensive.
Okay.
Prevention is affordable, and cure is unaffordable. So prevention is the best way to go. After realizing how this disease is caused, then you can avoid it. We said it comes in immunocompromised people, those whose immunity is low. You mentioned when you are introducing the program, and you said uncontrolled diabetes. So a way of preventing it is, if you are diabetic, control your diabetes. Take the drugs appropriately. Don't allow the diabetes to be uncontrolled, to be severe. Maintain it in its normal levels. Then also, I can also say, avoid self-medication.
Sure.
Those who take, every time they are sick, they just go and get amoxicillin, Panadol. Let's try to avoid, because the more you take those medicines, they accumulate in your body, and they affect the yeast, the fungus in the body, in those parts which you mentioned about.
Okay.
So the candidiasis comes in.
Okay.
So avoiding self-medication is very good. Then I will not leave without mentioning douching. Douching is what women use to wash their private parts. Some ladies use soaps, others use a lot of chemicals, in fear of, in trying to make the private parts clean, and they say have a nice smell. The private parts have their normal way of cleaning themselves. We advise our ladies to use water, clean water. If you have clean water, that is enough. The private parts have their own way of maintaining their own hygiene. Yes.
Okay.
As I finish up, I also cannot fail to mention to avoid HIV/AIDS as much as we can, because you mentioned in your introduction that it is common in those who are having HIV/AIDS.
Yes.
So as much as we can, let us stay safe.
Okay.
Those who have already gotten the HIV/AIDS, they should stick to their drugs to have their body immunity strong, to be able to prevent this candidiasis.
Okay.
Another way of preventing this candidiasis, I talked about the avoiding douching. I explained and said douching is ladies using some chemicals to wash their private parts, and some soaps, some detergents. And I said they affect the normal flora in those parts, and they get candida. Also, another point I cannot forget to mention is avoiding multiple sexual partners. Whereas candidiasis ideally is not supposed to be sexually transmitted, But when a lady has it and gets in sexual intercourse with a man, the man is able to transmit it from her to his wife and vice versa.
Okay.
So among the ways of preventing it or avoiding it is to have limited, for us in medical we say limited sexual partners. In Muslim you say you can have a number, but be faithful to them. So when you have your 3 hajatis, you be faithful to them and don't go outside. Then you will all remain safe and healthy. But if you misbehave and you go to another, you go for adultery and you pick the yeast, you pick the candida, you can bring that fungus, that bacteria, that fungus, you give it to your hajat, then you spread all of them, so you all have. So avoiding multiple sex partners is very key in preventing this candida. Also, we said in your introductory remarks, you said it usually occurs in people who are pregnant.
Yes.
Now, I explained and said the reason is because during pregnancy, the body's immunity is lowered.
Okay.
Now, of course, now we cannot avoid pregnancy because it is important.
Of course.
I can't say ladies don't get pregnant. No, it is important. But now what we do is we try to do regular checkups. That's why there's what is called antenatal care. Here in Africa, most of us go for antenatal care after getting pregnant. Actually, you will be surprised some women go even when the pregnancy is 6 months. But ideally, we would advise to go for the preparatory for pregnancy. Before a woman gets pregnant, we would advise her to go to hospital, do some checkups, make sure she's free from all these infections. Then she says, now I am ready to get pregnant. Then you get pregnant. After getting pregnant, you go back to the doctor, he tests you, he confirms, yes, you're pregnant. He does some checkups also, exclude this candida as well. Then different times of the pregnancy, you go back for the checkups.
As in regard to what the doctors have told you?
Yes. In doing so, you'll be, although you are pregnant, but you will prevent this candida from coming because you'll be doing those regular checkups in antenatal. Then, of course, there are very many ways of preventing, but we shall just hand a few. But before I finish, let me talk about chemotherapy. Chemotherapy is the medicine given to cancer patients. Now, this candidiasis is usually seen in people who are getting chemotherapy. Now, the challenge is you can't avoid the chemotherapy. When you have cancer, you go for chemotherapy. Of course. And the cancer alone reduces immunity. Chemotherapy also reduces, that's why it comes. But now what we do is we encourage you to report any sign as soon as it comes so that we handle it earlier. Remember, the earlier the better always. So when you see any sign, if you have a patient who has cancer and is getting chemotherapy, and she sees any genital itching, any painful urinating, you just bring her for us very fast, and we handle as early as possible. I may not mention all of them, but those are the few ways of preventing this candidiasis.
Doctor, now let's turn to its treatment. Is it curable, or once you have gotten it, that's the end of life?
Oh, thank you, thank you. The good news is it is completely curable. Very curable. You don't have to be worried. This is a fungal infection, so we give antifungals. And once a person adheres to treatment, takes them very well, then avoids the other, what I call bad manners, multiple sexual partners, the person can become completely well. Usually we give antifungals. Maybe I can mention the commonest ones: nystatin, fluconazole for swallowing. Usually we give for swallowing and also for inserting in the private parts. And the person takes them for like 6 days, and the person is completely fine. So when you take those, when you give you those antifungals, you take them. We encourage you to drink plenty of fluids, plenty of water to wash the disease out. The person becomes fine. Yes. So
it is curable.
Very curable.
But if one delays to go to the hospital, how severe is it?
That is the challenge. Always in delay. Actually, I always say that's the problem with Africa. with developing countries.
Okay.
People tend to spare their money. They say, I don't have money to go for a checkup. So they come to hospital when it is worse, where the person has serious vaginal discharge, serious pain. And there it becomes a challenge. You may end up getting other infections, which you call PIDs.
Okay.
But that comes when it is poorly treated or when it is lately diagnosed.
Okay.
Yes, please.
This now brings me to the risk factors. Who is at risk of getting candidiasis?
Yes, thank you. Very important, because all diseases have populations who are at more risk than others. So we must understand these classes of people so that we put more emphasis in, one, teaching them or health educating them, two, doing checkups on them. We usually encourage those who do like camps and what to go into these populations and handle them. Or if you have a person in this class, you be conscious that this person can easily get candidiasis. The first class of people are those who have HIV/AIDS. HIV/AIDS reduces the body's immunity.
Okay.
And now this fungus will use the chance to cause harm
To a weak body.
to a weak body.
Okay.
Remember, I said Candida albicans, the fungus which causes candidiasis, lives in our bodies normally. So our body's security defense mechanism keeps it in balance. I can say if you have some people who are, okay, if you have population like a country and the government is not strong enough to keep them in checks and balance, they will do whatever they want. So when a person has HIV/AIDS, the HIV virus goes and reduces the body's immunity. Now these other funguses use the chance now to cause harm. So anybody with HIV/AIDS should be on the lookout for this candidiasis.
Okay.
Again, another class of people are the pregnant women, the one I talked about, because pregnancy lowers their immunity. Now you are two people in one.
Yeah, of course, sharing the same,
I can say the same defense mechanism.
Okay.
It's like two countries having one army. So that army, strong as it is supporting two countries.
Okay.
It becomes weakened. So pregnant mothers, they are at high risk. Also diabetes patients, people with diabetes, it lowers the immunity, so they should be on the lookout to go and check for this. Another class of people are those ones with multiple sexual partners. Now, this is this Hajat, or this lady, let me say, who is there. She keeps herself well. She practices good hygiene. But maybe her man misbehaves and goes with very many women. So although this one has not looked for the candidiasis, but she's at risk because the partner is not faithful. So multiple sexual partners is a risk population.
I think that is that falls both ways.
Yes.
Women
yes.
too might be seated at home but having several sexual partners.
Yeah.
Okay, so this advice goes to both.
Both men and women.
Okay.
Let us be faithful to our partners and limit as much as we can. Another class of people are those who have cancer and are on chemotherapy. So they are most likely to get this. Actually, most chemotherapy patients, most cancer patients on chemotherapy usually get this candidiasis.
Oh.
So we encourage them and their caretakers to be on the lookout because they are highly exposed and at risk of getting this candidiasis.
Okay.
Yes.
Thanks a lot, Dr. Baker. A lot has been discussed about vaginal candidiasis, and I hope our beloved viewer, you are not left the same. Unfortunately, the end of our program is at this very time, and I can't go beyond the limit. I remain your host, Nambali Bashir, and until we meet in the next episode, inshallah, assalamu alaikum wa rahmatullahi wa barakatuh. you.